Obamacare is staying.
Now Idaho must make a couple of decisions that'll have a huge impact on how much those programs could cost you. Matt King is live in the studio with the story.
Yeah, Don Michelle, we brought you the dispute over a federal versus a local insurance marketplace last week. Today we wanted to take a look at Medicaid. Should Idaho expand it as Obama would like, keep it as is, or perhaps, if legal, reduce its coverage of some key populations?
I would be doing without. I'd probably end up dying in some corner of the park.
Without Medicaid, Ron Whitmore and Roy Nelson say they wouldn't live long.
A person would have to suffer through their illnesses.
Roy's degenerative back disease and a hernia in Ron's esophagus earned each surgery on the government's dime. Neither man believes Medicaid accomplishes as much as it could or should.
It doesn't have to be a jump through a hoop type of situation.
But both grow animated imagining what they do without coverage.
One prescription alone is $1,200. You know, without Medicaid, and then I wouldn't be taking them meds.
Safety Net Clinic doc Ted Epperly sees patients without Medicaid every day.
And they live sicker, die younger.
For that reason, Epperly supports Obamacare's forced expansion of the program. But the Supreme Court did not. It upheld the Affordable Care Act, but ruled that coercing a state to enlarge Medicaid or suffer the loss of federal dollars went too far. The state of Maine interpreted that ruling to mean it could strip coverage from those currently on Medicaid.
And it would appear under the Obamacare ruling of the United States Supreme Court that Maine and every other state can make those kinds of adjustments.
I see that as being stepping backwards, quite frankly.
Governor Otter appointed Epperly and 13 others to a special panel tasked with weighing whether or not to expand Medicaid in Idaho.
In terms of Medicaid and what we do with Medicaid, it's very simply a financial calculation.
Will this save Idaho money? Today? Tomorrow? In 10 years? The federal government promises to pay for 100% of the expansion for the next 2 years, and 90% after that.
So if we don't step forward and do this for the good of Idahoans, we're going to be paying taxes anyway that'll expand Medicaid in Washington, Oregon, Montana, Utah, and other places.
Greater coverage might mean help for more guys like Ron and Roy.
Sometimes, you know, in life, no matter who you are, I don't care if you wear a hard hat or a tie, you're going to come to some grips
and need a little help. Idaho must now decide how much that help will cost. Now, one of the big concerns many governors harbor is that the feds will shift many of the costs of Medicaid to the states, even though right now there's nothing officially in place to suggest that'll ever happen. Auditor panels plan to meet the first week of August. Live in studio, Matt King, Today 6 on your side.